Welcome back to Taking Charge of My Cancer podcast, episode 59. Join me today is Jahane Hunsicker. She is a four-year student physical therapist from Ocala. She is currently getting her Doctor of Physical Therapy degree from Nova Southeastern University, and she has served as the service chair of the NSU Student PTA. She earned her Bachelor's of Health and Science at the University of Florida, and he will earn her DPT in May this year. She's currently in the process of undergoing for her third clinical rotations for her last year of school and is finishing up her rotation here at the oncology outpatient setting with me at Med Plaza UF in Gainesville, and transitioning to an inpatient setting here in Gainesville at the VA clinic. Her passion is serving geriatric patients with neurological condition, as well as newfound fondness for oncology patients. Jahane enjoys gardening, pursuing bookstores, watching rom-coms, and cross-stitching in her spare time. So Jahane, thank you so much for doing this with me today.
Absolutely. Thank you so much for having me.
Great. So, I always enjoy doing this, and actually, I didn't think about interviewing my students until one of the students said, why not the students? And I thought that's a really good idea, because one thing that we know, unfortunately, in PTA school, oncology doesn't go in depth during your, learning process. We don't really teach as much. And part of it is just a lot of information that has to come across that sometimes when it's all these specialties, it's only like maybe one class, right? Or one day of like information for practice and to go into a lot of the specialties that we go through. And the idea is not to make you guys an oncology therapist, right? Or a cardiopulmonary therapist and sports therapist during your PT career. The idea is to just kind of like, put the seed in there, and hopefully you guys will continue pursuing more education after you graduate that can, get them into being a specialist in what you're going to do. However, a lot of you guys come completely lost, right? Because it's like, I have no idea about pretty much any of what's going on in here in the first week. So but before I go there, you always, you want to tell us a little bit why PT? Why did you decide to go into physical therapy?
Absolutely. So I've had this ongoing dream since I was a little middle schooler. One day I walked up to my mom and I was like, I really want to choose a career that I'm going to help people and make a difference. And so I was like, you know what? I'm going to be like you, Mom. I'm going to be a teacher. And she was like, no. She's like, pick something else. You're not going to be a teacher. I want you to do something else with your life. And so growing up, I have an older brother, and we have like this orthopedic bone condition where we have gone through a lot of surgeries. And so when he was in high school, he underwent a surgery on his hip to where they like shaved off a portion of his femur. And so his journey through physical therapy is what really sparked my interest in it. And then when I was in high school, I went through a similar surgery, but on my knees. And once again, physical therapy, they played a big role in my recovery, and just the upbeat personality of the physical therapist really helped to inspire me and just solidify that, yes, this is what I want to be doing. This is the field that I want to go into.
Awesome. Very good. And I think you're going to do really well in this field. You're doing fantastic. So coming into this internship, tell me, and you can tell me now, this is your last week, so 12 weeks later. So tell me how do you feel? Like, I think that if the students out there are listening to this, I think that will prepare you a little bit about, again, everybody experiences a little bit different, but I think everybody comes on the same shoes coming into a specialty clinic, and then with oncology mainly. So tell me how was like that first week for you like?
Yeah, I'm not going to lie to you. That first week was pretty rough just because I felt almost lost in a way, coming from outpatient orthopedic in my previous rotation, and coming into this rotation, it was something entirely new. Um, like you said previously, we don't really get a lot of exposure to what we do with patients with cancer and how we help them during their journey. And so during that first week, it was kind of a wake up call. And there's just a lot of self doubt at first, like, oh my gosh, there's so much that I feel like I don't know in this setting. I don't know if I'm going to make it 12 weeks. But once you got through that first week and you developed like the routine, you're like, okay, this is how, this is what we do when we see patients with breast cancer. This is the different things we need to look at. Once I kind of developed that line of thinking, I definitely started to feel more confident throughout the subsequent weeks.
Okay,
But
great.
yeah, that first week, it was a whole new world out there.
Exactly. And then look at you now, right now you are training. I have another student as well, and you are being the one that helping me in the training with him. So it's so great to see you guys coming like clueless week
Mhm.
one. And then he's been here, what, 3 weeks? And then you are like doing all the training with him now. No, that's not how you do it. This is what you do. And not only that, but as well teaching an undergrad APK student as well to just kind of like, so what are we doing with this type of patients? So it is really neat to see how much you guys grow through this. And like I always say to every one of you, my goal in life is to convert every one of you guys in oncology physical therapists, just because I think is such a, I mean, I love what we do. I love this type of patient population, but I feel like it's a huge need out there, and it is not that many physical therapists already that has been doing years in the profession that have no idea what to do with these patients. And certainly, as you guys know, we are getting better and better about cancer treatment. So we have more survivors, which have more chronic issues due to cancer treatments. So we better know how to treat them, because if you even go into outpatient ortho, more likely you're going to come across a lot of our patients who maybe 2, 3 years down the road are having issues with their shoulders due to prior mastectomies or due to neck dissections due to head and neck cancer. So I think it's really neat to see you grow. So you will be great. And I'm so glad that you actually maybe be thinking about exploring to work in this field when you graduate in May. So that will be great. So if you have 3 valuable tips that you learn about your journey that you can give us from the student standpoint, but as well for our audience, patients with diagnosed with cancer, what that will be?
The first one, it would just be to just be a sponge in the clinic. There are so many differing viewpoints in the clinic, different techniques that can be used. And when you're a student, it can be overwhelming at times, but at the same time, it's great to just be exposed to all of those different lines of thinking, to where it kind of challenges your clinical reasoning and helps you further solidify that as you go forward as a clinician. So just be a sponge and take in all of that information. Um, Also, it's super important to have a positive personality whenever you are working with these types of patients. Like, a lot of times they're coming to you, they're feeling not the best because of the treatment that they're going through, or they just had bad news about their diagnosis. And the last thing that they want to do is come to a PT that is also has like a negative personality, and it isn't trying to build them up and try to find the bright side of whatever news that they did receive. Like, yes, this is bad. However, look how far you've come. You've done it once. We're going to do it again, type of thing. So I think it's super important to just portray that positive personality and just try to build your patients up so that by the time they leave you, they just have a smile on their face and they feel better than when they did come in. And then I would also say it's I'm going to give you 4 because I couldn't pick just 3.
Everyone, yeah.
I had so much. The third one is, from the student perspective, it's okay to not be perfect in everything that you do. I think as students and just as people in general, we're so afraid of making mistakes. And then we beat ourselves up about this mistake. Oh, I should have done this with the patient and they could have benefited from this instead of what I did do. But you're constantly growing as a person, you're constantly growing as a clinician, and trying to better yourself. So whenever you feel like there is no more room for growth personally, that's kind of when you're doing a disservice to yourself and to your patients, because there's always something that you can learn from, or extra knowledge that you can gain from an experience. And then the fourth point I would say is, don't be afraid to lean on your support systems, whether that be friends, family, just like support groups in general. From the student perspective, like these clinical rotations have super long hours. You're constantly studying at the end of the day, and a lot of people were prepping for licensure exam. So it takes a toll on you both emotionally and physically. And then even from patients who are undergoing treatments, they're feeling really fatigued and down about the things that they are going through. And so they need to also have that strong support system that they can lean onto. And I think so often we try to be very independent and try not to be a burden to other people. And that's not what we need to do. We need to feel comfortable in leaning on other people for help.
Mhm. And then how about for patients? The last one was a good one for patients. Any other tips for patients that you have learned during your internship that can be very valuable for them to kind of go through this cancer journey?
I would say to try to get like as much information about like your diagnosis and what to expect going forward, whether that be from your physical therapist or your doctor. Like, don't be afraid to ask questions. So many people, they come in and they're like, well, I don't really know why I'm here. Like, I don't understand the purpose of this. So I think just really being transparent and asking those questions, even if you feel like it's kind of a dumb question, there are no dumb questions. Like, you need that knowledge going forward to know what to expect.
Okay, very good. How about your most painful lesson that you have learned in this journey?
The most painful lesson I would say is just like the emotional toll that this working with these types of patients takes on you. It's so, like, prior to this, I mentioned I was an outpatient ortho, and it's not you have a level of compassion for people with orthopedic conditions, but whenever you come into this type of setting, that compassion is just heightened. Just trying to put yourself into the patient's shoes and what they're going through. Um, I didn't quite realize the emotional toll it would take on me, because I am such like a sensitive person and I take on other people's feelings. So I think kind of taking care of me personally, and filling my own cup so that then I can fill others' cup was very beneficial for me, and something that I had to kind of learn in my first couple of weeks here, that I need to take care of myself emotionally so that I can take care of others,
Yeah,
essentially.
that's a very good point. And I kind of thought that in the beginning too, when I used to do orthopedics as well for many years. And when I started doing oncology, that was one of I was afraid of. I was afraid of, how much emotional toll this is gonna be. And I'm like you, I'm very sensitive. Like I can cry with a Johnson and Johnson commercial, baby commercial.
Mhm.
I'm a very easy crying person. So I'm like, how this is gonna go? Like what I'm gonna put my strong face on. A patient doesn't need me to be bawling with them. At the same time, they're not really feeling good. But it's nothing wrong with that. So I've been learning that Yeah, do I do that with every patient? No. Do I becoming stronger about not doing that? Yes, I think that you just, you just get yourself a bit hard or not hard, but you're learning how to manage that and that really thinking like, what can I do? What you just said before, how can I bright this moment? How can I get a smile to this person right now? How can I see them like look at the positive part in the middle of all this bad news they're getting? And I think that's what has been helping me, right? To just really either, start getting, and then they we build this relationship that, we is beyond just being my patient, right? So this is just, you can count on me, you can tell me anything you want to tell me. And then we kind of build this relationship where I can actually almost make them kind of smile, or we get we throw a joke about the bad situation if it's possible. And I would say 9 out of 10 times, they, like you said before, they walk out of here with a smile on their face. They're still feeling like, stress, of course. They need to figure out how to tell this bad news to their kids or their family members, but at least they come out with a different point of view of, or feeling a little release, if you want to say so. So, but with the same point, it's so rewarding to see what the person they become. Like, we have, and I think I already mentioned this on a patient before who I interview, and the podcast and the audience will listen to it at one point when I release it. But it's so great to see when I used to have a bad news from her, she was just totally, a mess, like really sad. And versus now it's like, well, it is another spot, another pet, another spot. They're going to do this, they're going to do that. It's like a completely different person, like so strong. So like, okay, well, it is another thing that I need to kind of look into it. And then we'll see what happens with chemotherapy. But at the end of the day, how do you feel? What is your quality life like? How are you are you doing everything you want to do versus, or how you feel now versus how you felt 3 years ago when I started seeing you? Those kind of things that they're like, make them feel like, yeah, you're right. I don't feel bad. I don't feel sick. I feel great. I'm really in shock that the pet is showing another spot. But if it's showing another spot, so what, right? That's why medical oncology is there to support you and give you the chemo treatments that hopefully we can do to control the disease. But, the whole point is just kind of really get them as functional as they can, enjoy what they enjoy doing, and don't try to really give up anything they do. That's pretty much the whole goal, right? So, so same thing, what happened with you guys initially can be a lot of emotional burden, but you start to see the rewards from it. And that make you they make you stronger, right? They make you start to use even one patient example to another patient. And they're like, oh, look what happened to her. And look what she's up. And then sometimes that really help them because it's somebody else who has been on their shoes as well. If if it's anything that you have that will be of a value for the audience, what will be that?
I think it's finding a method of self-care that works best for you, whether it's from a clinician, a student, or a patient standpoint. Just finding a hobby or just like an outlet that you can return to and kind of help you to work through some of that stress. Myself, I like spending time with family and friends, cross stitching, reading a lot, anything that is going to help to kind of take your mind off of everything else that's going on and help to relieve your stress, I think is super important. Just from an emotional standpoint, just kind of taking care of yourself so that you can take care of other people. And so that like you can exude that positive personality versus, oh, I'm stressed all the time. Like I have this I'm going through, and you're kind of portraying that onto other people.
Great. That's a very good advice. And how can people find you? And I will put some of that information on the show notes, but how can people find you?
Absolutely. So I'm on Instagram and Facebook. You can reach out to me either method there. And then I'll also provide my email address. Feel free to shoot me an email about any and everything, any advice.
Awesome. It has been 3 books that you will recommend for the audience. What will be and why?
Okay. I thought long and hard about this one. So um, I am really big into fiction books right now since I do spend so much time studying and focusing on the educational aspect of my career right now. So I read a lot of fiction books and I'm really big into like the fantasy genre. So I really liked Court of Thorns and Roses and The Cruel Prince. Both of those are kind of fantasy books, but I also enjoy like romantic genres because just because of my namesake, that's kind of how I got my name was from romantic books. So I enjoyed the book Love in Other Words.
Okay,
So
nice.
yeah.
Very nice, very nice. How about podcast?
Podcasts. So I do listen to like a lot of TED Talks and kind of motivational podcasts that give you, you know, a nice little motivational quote of the day that you kind of focus on throughout the day. But I also enjoy like true crime podcasts and spooky podcasts. So I listen to like Morbid, a true crime podcast. And then Two Girls, One Ghost is like a kind of spooky paranormal podcast. So I enjoy both of those. And it's another way that I relieve my stress is by listening to those types of podcasts.
Excellent, very good. How about movies?
Movies. I love romantic comedies. And I'm big into like 90s, like 80s, 90s. So I like While You Were Sleeping with Sandra Bullock in it. And then I'm a good Pride and Prejudice gal. So I like the Pride and Prejudice movie with Keira Knightley in it.
Nice, nice.
Both
I
of those
like
are
that.
wonderful.
Yeah. And then to wrap up, it will be any kind of like resources or like what would you be kind of advising patients? Like if you are just being diagnosed with cancer, what would be like your advice to them based on what you've been learning here and what you've been studying? So we can go from like, you're diagnosed, what will be a good, things for you to look into it? What about if you go, through cancer treatments? What about when you're already past your cancer? You're done with your treatments, but you still continue dealing with some of that secondary effects, so just kind of really go day by day as a cancer survivor. So what kind of advice do you have for them?
So whenever a person's first diagnosed, I would just kind of recommend them delving into and trying to gain as much information as they can regarding their diagnosis. The American Cancer Society website has wonderful resources that can be used going forward about what to expect, different treatments, and all of that. Um, and I would also say that establishing a strong support system going forward, whether you're first diagnosed, you're going through the treatments, or you're even on the other end of it. Establishing that support system, whether it be through family members, through a support group, which once again, the American Cancer Society does have that resource for different support groups in your area. Um, I think that would be very valuable so that you do have that outlet and people around you to help build you up. Um, and then the third thing I would say is establishing like a daily routine of physical activity going through treatments. So many times we see patients that are complaining of fatigue and just feeling really down and not feeling well because of them, the treatments themselves. And so what we tell them, best thing to do, stay active, do some method of physical activity, whether it be biking, whether it be dancing, yoga, something that's going to that you can incorporate into your daily routine that's going to help to combat that fatigue to where you're going to feel better afterwards. And that's can be for patients who are going through treatments or even if they're on the other end of it. It's super important to stay active even throughout once you conclude the treatment. So YouTube has a lot of wonderful like workout videos that they can just put on, even if it's like a dancing video and or like yoga, different resources like that is kind of what I would recommend for our patients.
Okay, and that's fair. How about physical therapy?
Physical therapy. So yeah, physical therapy is super, super important. See, I was assuming, we're talking at your physical therapy appointment. Like you are here, this is perfect. But no, we play a very large role in these patients' lives, just trying to, like you said, maintain their functionality, keeping them active, and trying to just help them navigate through their journey, which can be very harrowing throughout.
Yeah, yeah. And you're right. Again, sometimes we are becoming more and more important as a part of their interdisciplinary team. Like, here I have the fortune to have an amazing team where I'm part of tumor board, and my my comments and my knowledge, and they really value what we can do for these patients. So it is really nice for patients to try to find that, try to find that whole team approach. It's not just the medical oncologist here and the surgeon here, and then you're on your own. I do my part. The surgeon did whatever they needed to do. You continue on other adjuvant treatments by the medical oncologist. Perhaps you have radiation, and then you're done, right? And there's nothing else you can do, but there is so many more things you can do about it. Really establish, like I said before, with a physical therapist that can help you through the whole journey. Nutrition is huge on your role of like really getting yourself more, increase energy or really deal better with some of the secondary effects that chemotherapy or even later on, hormone blockers will create on your metabolism and your body. Mental health is huge. So again, having some support from that aspect, but not just with counseling, but as well as we know how important exercise make a huge role on your mental health, because the amount of serotonins that you can have after exercise. That's how I do take care of myself in a daily basis. So really, just it's a lot of different options out there, but I think that's sometimes, we go see PT when we have a pain somewhere, right? So I have a shoulder pain, I need to go see PT for that. But when you're like, well, I really don't have any pain, I really don't know what I'm here. I was just diagnosed with, breast cancer or head and neck cancer. I really don't, I'm fine. I don't think I need you. I may need you afterwards, but it is so crucial on that pre-op appointment, how much education we can provide and help them to prepare a little bit better for after surgery, and have a lot of tools to try to see how can you be better, how can you make your body better so you can really beat this cancer, you can really get the best out of all these treatments to feel yourself as much as you can. So I think that that's going to be really important. So, but Jahane, you did amazing. Thank you so much for doing this with me. Like I say, I would love to see you down the road being one of my oncology colleagues and, going back and forth, asking questions about cases. We always here for you. So thank you again for being part of this, and thank you for being part of this podcast. I really appreciate it.
Absolutely. Thank you so much.
Okay, you take care. Have a great day.
You too.